but that's a myth. Turns out 1 in 8 Americans suffer some sort of hearing impairment.
Fox 17 Derek's Francis has a story in today's medical moment.
According to audiologist Dr. Deb West of Spectrum Health, 40 million Americans suffer from some form of hearing impairment. And despite what you may think, it's not just older Americans.
1 in 14 Generation Xers, if you will, are starting to show signs of hearing loss. And Generation Xers, that's 20 years old to 39, so that's pretty young.
The numbers are even more surprising when you consider 1 in 6 young adults, 12 and older, have some degree of hearing loss. There are several different reasons for hearing impairment, but 1/3 attributed to loud noises in our environment.
Lawnmowers, it could be snow blowers, things you do time and time again at excessive loud levels over a long period of time can definitely create hearing loss.
Studies show 80 decibels is the key level when hearing starts to be damaged.
80 decibels over a long period of time, typically around 8 hours, starts to create that shift. And then as you get to louder levels, 90, 100, that time gets less. Lots of our just everyday use of equipment and things we do are at least an 80 dB level. Shifts can sometimes be temporary and hearing gets better, but shift upon shift can create that permanent type of loss. Sometimes with music and how younger kids, but it could be older as well, how they listen to it is well into the 90 and 100 dB range.
In addition to external noises, there are other items that fall into this category of acquired hearing loss causes.
Sometimes ototoxic drugs, loop diuretics and chemotherapy.
The second category of hearing loss causes is congenital.
Congenital is something that happens in utero, so something the mother, maternal illness or virus.
Dr. West adds 50% of hearing loss is genetic, and whatever the cause, she'd like to see patients do something about it a lot sooner.
Let's say we have signs or symptoms of something pretty severe, like a heart attack or a stroke. Yeah, you're going to go seek help right away. Hearing definitely is more a social, emotional impact, but with the hearing loss, you're going to see the withdrawal from conversations at times. You can see fatigue and frustration. And one big one is strain among social relationships. So, people will come in all the time with a spouse and say, if you don't do something about their hearing loss, I'm going to move out. They're joking, but really true frustration. And not just on there, and on the person that has the hearing loss too. They don't want to have the hearing loss.
Dr. West says it takes on average 7 years for a person to seek help after their original diagnosis of a hearing loss. And that's especially frustrating for her because of how much they can be helped.
90% of aidable hearing that can be helped with some type of hearing aid technology. 10% of hearing loss can be surgically corrected.
And next week in part 2 with Dr. West, we look into the early symptoms of hearing loss and the best ways to treat it.
And here's a video that could brighten your day. This is a site that made